If you're looking to boost blood flow and circulation, proper diet and exercise are absolutely the right place to start. But sometimes it takes an additional boost. In this video, I'll share the top 10 supplements to help boost circulation. Now, keep in mind that supplements should be a supplement to a healthy diet and exercise, not a replacement. Additionally, make sure to check with your doctor before starting any supplement to see how it may affect your health. So first up are omega-3 fatty acids. Those are found primarily in fatty cold water fish such as salmon, mackerel, or sardines. Omega-3s help decrease inflammation, improve blood vessel flexibility, and they help decrease blood pressure. Studies show that 1,000 to 2,000 milligrams of combined EPA and DHA, which are two types of omega-3s, can help improve circulation. You can get that either by supplementing with fish oil or by eating fatty fish 2 to 3 times per week. For vegans, you can get omega-3s from nuts and seeds, such as flax seeds, chia seeds, hemp seeds, or walnuts. But note that those forms are in ALA or alpha-linoleic acid, not in EPA or DHA. And ALA is a little less bioavailable. So just keep that in mind. Next up is L-Arginine. L-Arginine is an amino acid found naturally in meats, nuts, and dairy, and it's a building block of proteins. Typically, you can get enough arginine through a protein-rich diet, but if you do need to supplement, doses of 2,000 to 6,000 milligrams per day have been shown to help boost circulation. Next up is L-Citrulline. L-Citrulline comes from watermelons and is also an amino acid, much like L-Arginine. In fact, L-Citrulline gets converted into L-Arginine in order to help boost circulation. Now, you may wonder, why take L-Citrulline if it has to get converted into L-Arginine anyway? And the reason for that is bioavailability. It's better absorbed, and so you only need about half the dosage, 1,000 to 3,000 milligrams of L-Citrulline, to get the same effect as L-Arginine. Additionally, it causes less abdominal discomfort sometimes than L-Arginine does. Next up is Coenzyme Q. CoQ is found in small concentrations in meat, fish, and whole grains, so it is sometimes helpful to supplement. CoQ is a coenzyme that's involved in the electron transport chain, which is part of the way that your body converts food into energy. And having enough energy is essential to having healthy heart muscle. CoQ is also an antioxidant and can help reduce oxidative stress to your blood vessels. A typical supplement dose is 100 to 300 milligrams per day. Next up is beetroot, which, as you might guess, comes from beets. Beetroot is a natural source of nitrates, which get converted into nitric oxide. Nitric oxide is a vasodilator, which means it dilates or expands your blood vessels and helps improve circulation. You can get beetroot either from eating beets, drinking beetroot juice, or taking beetroot powder. 500 milligrams to 1,000 milligrams of beetroot powder or 250 milliliters of beetroot juice per day are the typical supplement doses. Next up is vitamin C, which comes from citrus fruits like oranges or grapefruits. Vitamin C is an antioxidant, and so it decreases oxidative stress on your blood vessels, and it also has an anti-inflammatory effect. You can get vitamin C naturally through eating citrus fruits or drinking orange juice, or you can supplement with 500 to 1,000 milligrams per day. Much like vitamin C, vitamin E is also an antioxidant. It has anticoagulant properties, which means it prevents blood clots from forming. It also helps decrease oxidative stress on the arterial walls. You can find vitamin E naturally in nuts, seeds, or leafy greens, or you can supplement with 100 to 400 international units per day. Take note when looking for vitamin E supplements to look for mixed tocopherols. Alpha tocopherol is the most common, but you also want to get delta and gamma tocopherols. Additionally, look for the naturally occurring vitamin E, sometimes labeled D-alpha tocopherol, versus DL, which is more the synthetic version. Next up is Ginkgo biloba, which comes from the ginkgo plant. Ginkgo biloba has been known to increase blood flow to the brain and to the extremities. It's been used for cognitive function as well as for people with cold hands or cold feet. Do take note that ginkgo can interact with some medications, particularly blood thinners, so make sure to check with your doctor before starting to take ginkgo biloba. Next up is vitamin B3 or niacin. Niacin produces nitric oxide, which again is a vasodilator. Take note that if you take niacin, you may feel a flushing, so if you're sensitive to that, look for an extended release form. Niacin can also help with cholesterol. It helps lower bad cholesterol or LDL, and it helps increase good cholesterol or HDL. If you're looking primarily for the cardiac and cholesterol benefits, taking a niacin or B3 supplement on its own at 500 to 1,000 milligrams a day can be helpful, but take note that taking a B complex can also be a source of niacin, as other B vitamins such as B6, B9, and B12 are also helpful in boosting circulation as well as energy. And last but not least is curcumin, which is one of the most well-researched natural anti-inflammatories. Curcumin comes from turmeric root, and so you can get curcumin naturally by eating turmeric. However, the effective dose is around 500 to 1,000 milligrams per day, and curcumin only makes up about 2 to 5% of turmeric. So you'd need to eat on the order of 1/4 to 1/2 cup of turmeric to get the same effect as supplementing. Also take note that curcumin is much better absorbed when taken with black pepper. I actually had someone comment on a previous video that they like to take a couple pure black peppercorns with their turmeric, and it does actually help improve the bioavailability. But if you're not up for that, there are supplements that have black pepper included in the capsule. So those were the top 10 supplements to help boost circulation. But you're probably wondering, which ones are most important? After all, I think most people probably don't want to take 10 pills. There are supplements that have some of these combined into a single supplement, and when reading labels, just look for the ingredient label and look for the supplements that I mentioned in this video. If you're looking individually as to which ones to take note that you can get a lot of these through a healthy diet that's rich in protein and through taking a multivitamin. Now, if you're looking for the ones that you're most likely to need to supplement, those are probably omega-3 fatty acids, unless you're eating fatty fish 2 to 3 times per week, Coenzyme Q, and curcumin. Keep in mind to always check in with your doctor before starting any supplement, and always keep diet and exercise first. If you'd like additional tips to improve circulation, check out this video over here. But before you go, if you found this one helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.